Go.
All right. Good morning, sir. Good morning. This is Professor Owolabi of Balm of Gilead Specialty Hospital, Ilesa, and IVF Center. So this morning I'm going to be asking some questions about IVF and also some frequently asked questions that people want to know about IVF. So, sir, can you just describe your setup? In your few minutes about your center.
Yeah, thank you very much. The Fertility Center that we have at Balm of Gilead Specialty Hospital, Ilesa, Osun State, has been running since 2011, and we had our first baby on the 13th of March 2013. That's the first baby that we had outside Lagos in the whole Western region. That baby was the first baby outside Lagos, and we call it Baby Gilead. And that was the first success. Though we know there are other centers, but that was the first baby that we had in this region. That put us on the world map. It was reported in Guardian newspaper that year. That's an outstanding achievement. And since then, we have been helping women that needed infertility, that have been having infertility issues over the years to achieve pregnancy. And our success rate has been outstanding. Most of our cycles, we have 60%, 50%, 70%, success rate per cycle. And this year now, at least we have delivered about 3 sets of triplets to the glory of God. And we are really telling women that need infertility to come to our center to assess it.
Okay, sir. Thank you for your lovely answer. So what are the processes that will need to be done for a prospective couple that wants to do IVF at this center?
Yeah, the prospective couple that need to do IVF, they need to book appointment. Again, most of the time, they also want to know the duration and how long the treatment will take. Usually, we counsel them for the initial assessment. When they come, we assess the couple, we interview them, we counsel them, and we identify the factors that are found in the couple. And so we're able to now plan the cycle. Because we run our IVF in cycles, we don't do it individually. We have to harmonize the people that are ready, the couple that are ready for the cycle. We harmonize their cycle together and we place them. And usually the treatment lasts between 5 to 6 weeks. But those periods, they have appointment and they come. As I said, the initial assessment is done, then we know that the couple, the woman's menstrual cycle is controlled. And so other people that will fall into that batch, their cycles are controlled. And once the schedule is made, then they are selected to the batch. The whole treatment takes between 4 to 5 weeks.
Okay, sir. That's a good answer. For a prospective couple now, what are the investigations that's routinely done for IVF?
It's very important that if they have had some investigation before, they will bring it. Hormonal say, maybe they have done tuber tests, they have done HSG. They bring everything that they have done. We now assess it. Critically, we do a 3D ultrasound scan for the woman to assess the womb, because we want to make sure that the womb is ready to to receive the baby. What we normally rule out is fibroid. If there are fibroids that can distort the endometrium, then we will recommend that the woman will have surgery first. But if the womb is okay, we also look, then the next thing is to do the full screening test. The full screening test involves tests of various types of infection. We want to make sure that their health status is ascertained. And then hormonal assay for the woman also is done, and infection screening test is done for the woman. Also for the husband, infection screening test is done, and again, semen analysis of the husband is done, so that we'll be able to know whether the sperm count is normal, and that can go for conventional IVF, or if the sperm count is low or has severe oligospermia, we can now recommend intracytoplasmic sperm injection for such couple. So after the investigation, initial treatment is taken. That initial treatment is aimed at taking care of infection, because one thing that is common in the environment is infection, both in the couple. We call it genital tract infection. We do the investigations. We also treat the infections, making sure that the infection is eliminated in the couple. And as such, then, depending on the method that we want to use for them, the woman has to be stimulated to produce egg. A period of time will come when the follicles that are being produced is tracked. That's called follicular tracking. And once the follicles are tracked, we know when the final injection will be given, so that for the final maturation of the eggs that is being produced by this daily injection that we give to them. Then the day of egg retrieval is set, where we retrieve the egg that has been produced by the woman, and the embryology section, the embryology room, we pick those eggs, identify them, grade them, and put them in the incubator. That day, the husband will produce sperm. Once it produces sperm, it is washed and graded also, and then assessed. If it is normal, we use the conventional IVF insemination. But if it is if it is oligospermia or the sperm is very low, then we have to resort to using the intracerebral sperm injection. All these methods are available with us.
All right, sir. Thank you very much for your answer. So for patients which that are quite older, what are the options for them? Let's say patients that are over than 40 years old. What are the options that we can provide for them?
Yeah, the older patients, especially between 40 and 43, we do assess them and assess the quality, the possibility of them still producing egg. There's one hormonal assay we call AMH, antimalarial hormone factor. We do that test to see whether they can still produce egg. Now, anybody above 43, 44, 45, even though they might have even reached menopause, they can still be treated. They can still, carry their pregnancy once their womb is okay, but they will need assistance in terms of egg donation. That's where the egg donation process comes in for women who are perimenopausal or they already have menopause, and even some women who has premature ovarian failure. They will need what we call the third-party assisted conception process, whereby they use donor egg. A lady of younger age will donate the egg. We use the husband's sperm, and then we transfer the embryo into her womb, since there's nothing wrong with her womb. Those who have medical challenge or they have problem with their womb, maybe the womb have been removed by surgery, or they have had radiotherapy, or they had one treatment or the other that made them not able to carry the pregnancy, then surrogacy will come in, where we get a gestational carrier, a younger woman who has had pregnancy, who has had delivery before. We contracted to assist them to carry their pregnancy, and we have had a lot of success in this area in our center, the Balm of Gilead Fertility Center in Ilesa, Osun State. And so we enjoy couples that has this problem of delay in fertility to seek early, to approach us as soon as they are aware of that, and that will help to mitigate the problem of infertility that's at an epidemic level in the community.
Yeah, thank you very much, sir, for your answers. It has been very informative. So hopefully for next time we will discuss more on this series of interviews.
All right. Thank you very much.
Thank you.